All right, let's get this show started. Good afternoon. Thank you for joining us today. My name is Miguel Trejo. I serve as a Community Relations Assistant with the Community Council of Greater Dallas. Community Council has been serving the Dallas area for over 80 years. Our mission is to improve the quality of life of individuals by alleviating poverty, fostering independence and wellness, and connecting people to the resources they need. Today, we will talk about our All of Us research program, evidence-based programs, and our call to action. At this time, I would like to introduce you to Chris Howell. He's the president/CEO of Chris Howell Communications. And with that being said, take it away, Chris.
Thank you, Miguel. I appreciate that introduction. All right, and again, welcome to the program. You may be asking, what is the All of Us research program? Well, let me tell you a little bit more about that. The All of Us research program was started by the NIH, that's the National Institute of Health. They created a nationwide research program focused on precision medicine, also known as personalized medicine, to help researchers understand more about why people get sick or stay healthy. The All of Us research program plans to recruit 1 million or more people to share their health and lifestyle data. The program recognizes the importance of recruiting traditionally underrepresented populations living in the United States. When you join the program, you will be contributing to an effort to improve the health of future generations while also advancing precision medicine and learning more about your own health through better testing, better medicine, and more information passed and presented on to you. The All of Us research program is your chance to make an impact and get involved in direct, cutting-edge research and to find solutions to help people with healthcare and research. Also, it is an opportunity for you to get involved in other health-related programs in our community. So again, welcome to the show. We're going to unpack that a little bit more. And as we do, we're going to talk with Jessica Walker. And first of all, let me let you know who the guests are. As we get into this conversation today, joining me is going to be Dr. Heather Kitzman. She's the research director at Baylor Scott & White Health and Wellness Center. Jessica Walker, she's Director of Community Wellness at the Community Council of Greater Dallas. And also Cynthia Franklin, she's the Manager of EBI and Special Grants at the Community Council of Greater Dallas. So as we get started, we'll start with Jessica. And Jessica, welcome to the show.
Thank you, Chris.
Absolutely. Jessica, let's start by, first of all, telling us what are the 3 call to action items that folks need to do right now as we get ready to launch into this new year?
That is an excellent question, Chris. And I am going to give you those 3 items. But before I do, I just wanted to talk about this year. We have been into one of the, I guess, the worst years in the country since I've been around, since you've been around, since many people have been around. The last 2 years, actually. We've had many issues. The pandemic has been paramount. With that said, we have had to look at research. We've had to do everything differently. We've had to do a lot of virtual events. And it led us, after we had these events, it led us to the fact that we needed to look at a call to action that would be impactful for our community. Some of the events that we've had is reaching one community at a time. We did that at Friendship West. We had an opportunity to interview the pastor there and his lovely wife, Pastor Haynes. That was an excellent event that taught us something, and we needed to figure out where to go from there. Our next event was For Me, For You. It was a national event that we talked to some national experts about the All of Us research program and other elements. What is it for us? What is it for you? What is it for all of us? We had a shining light, the critical role of faith leaders in the pursuit of health equity with the Alzheimer's Association. That was an excellent event. And then we had opportunity that we were present in person in a community in Duncanville. Let's get moving through the pandemic. We also had Mythbusters talking about COVID-19. And then finally, we had a Cooking with Paul show. The one thing that we had when we had an event with you a while back, it was called Community Health, a conversation about all of us, a community health conversation. That led us to think that we needed to come up with an actual call to action to really think about where do we go from here. So this is what I wanted to really sort of highlight today.
Okay.
Number 1, consider enrolling in the All of Us research program.
Absolutely.
We're going to talk about that a lot today. The second thing is consider taking charge of your health. When you think about the All of Us research program, you really have to think of all of the elements involved in how do we really take charge of our health? How do we get healthier? how do we participate in research in order to allow our DNA to be tested, to be able to know what's going to happen to us later on. And then you have to look at some programs that are going to be impactful for us later on as we are dealing with taking charge of our health. And the last thing is we want people to consider being a leader or a champion in your community. That's going to be really important, and we're going to highlight all of those things today.
I like that. I like that. So again, you've got the action steps. Again, we will unpack all of them today, but we are off and running. We're going to start with our first question from the audience. We have Paulette Fields, who's going to kick off our questions from the audience. It is an interactive event today. You will see audience participants come up and ask questions throughout the show because, again, it's all in an effort to make sure that you're fully aware and informed of everything that's going on with the All of Us Research Program. So as we get Dr. Kitzman, I believe this first question is going to be for you. And again, we're going to hear from Paulette Fields.
Why is this research so important, and how does precision medicine relate to the All of Us Research Program?
All right. So why is this research study so important? It's the largest initiative ever funded by the National Institutes of Health. As we said earlier, we're trying to recruit 1 million people and get their DNA samples along with their history of health, chronic disease, different diagnoses they may have had, and get that all into one big database where researchers from around the United States can access that data. It's de-identified and confidential to try to look for patterns in disease in their specific topic area. So it could be a nephrologist that's interested in kidney disease. They would have access to thousands and thousands of people's data that is de-identified, and they can look for patterns. And that's where that precision medicine piece or personalized medicine piece comes out. What drugs and treatments are best for which populations and which diseases? We think of chronic disease like diabetes as a one-size-fits-all, but it's actually not. There's different genetic variations. There's different ways that we respond to medications based on our genetics. So that is one of the primary purposes of All of Us, is to try to develop personalized medicine.
Wow, that's really good stuff because, as we get ready to set up for our next question from Nancy Wilson, I just want to say that when you talk about that precision medicine, that's important because, again, we all know someone who's received a prescription and the medication may not have worked the first few times they took it. Had to go back to the doctor to say, hey, this was not quite working for them. Okay, let's try something else.
Yep.
But when we talk about precision medicine, that allows, if you can get involved in the research, that allows better chances for when you get that medication, it works for you the first time.
Absolutely.
Guaranteed, but it certainly increases the opportunities for it. All right, so I believe now we have another question from the audience, and we are going to hear from Nancy Wilson.
Hi, so my question for you guys today is, why is there a lack of representation in diverse groups in medical research?
Good question. Anyone want to take a stab at that one?
I'm happy to do it, but I'd like for you guys to answer first. Why do you think there's a lack of representation?
We have had, historically, in the African American community, and I can speak for that, we have had a lot of things to happen. When you think about the Tuskegee experiment back in the day, that was something that put a bad taste in a lot of African Americans' mouths. And so they were discouraged from participating.
Yep. Any additional thoughts?
No, that's mostly it. It's the history behind it. It's the fear.
Yep.
There is no belief in the system. There's a hesitancy because there's no trust.
Yep.
I think that's a very good question, and I'm glad that Nancy asked the question. I guess so the question now becomes, how do we overcome this mistrust? Because we have to do something if we're going to get folks involved with the research, if we're going to increase our chances of our medication being better for us. Mm-hmm. How do we overcome this? And what are some of the ways that you guys are working over at Baylor Scott & White and other resources to try to overcome it?
I think one of the primary ways is for us to be good stewards of research in the community. So making sure that we have long-term partnerships and that we train and educate people on what is a good research study versus maybe a not so good research study. Teaching them about how it's voluntary and the ways that their data is protected in ways that wasn't in the 1960s. Because of the horrible things that happened in the past, we have many new regulations that are monitored at the federal level. And I think teaching people about that and then champions that have been involved in research going out and talking to their communities and saying, this is how this helped me, this is what the process was like, and I enjoyed it.
Wow, good stuff. So again, you've heard us talk a little bit about it. If you've got any questions regarding the All of Us Research Program up to this point, certainly feel free to take advantage of the information that's on your screen to consider enrolling and becoming a part of this program so you can be a voice for those who may not have a voice and when we talk about overcoming the myths, you can be a part of the solution in that by, again, enrolling in the program. So take advantage of the information that's there on your screen. Okay, so Heather, as we get into this, what's next? I mean, we've talked about the myths. We've talked about, again, considering enrolling in the All of Us Research Program. What's next for the program?
So one of the things that we recognized during the COVID pandemic, and I think this was an issue before that with our underserved populations or our lower income populations, is just having the time and the resources to come into a clinic and sign up. That can be a lot of work. So we're working towards having a fully virtual mail-in option for folks. So they would do everything online or virtual with us, and then they would be able to return their saliva to us via mail. And I think that'll open up an even greater audience. Also continuing now that COVID is hopefully on the way out, doing more in-person events with CCGD and our other community partners where we can enroll right on the spot. So we can go to where people live, work, and play and enroll them right there so they don't have to do anything else.
Wow. You know what? I think that is, when we talk about cutting edge, I think that's cutting edge because that removes the barriers.
It does.
Because again, a lot of times folks may want to participate, but it's time constraints, it's transportation,
Yep.
all these other issues,
Yep.
but you just remove a ton of the barriers.
Yep.
So hats off to you guys for implementing it in that way.
And also, Chris, she mentioned partnerships, collaboration. Just being a partner with you has been great. And
Yep.
we are reaching out to other partners too, as well.
All right. All right, so now we have our next question, and I believe it's from Candace Sharp. Candace, fire away.
How does participating in research correlate in participating with the evidence-based programs?
That's a great question, and it's simple, really. Today we've been talking about research and how participating in that research can help to further generations of knowledge about research, can help to produce better medicine and also better testing. Well, our evidence-based programs are a product of that research. They have been tested at the highest level and shown to actually work. So they can help you to improve your quality of life. They can help you with reducing healthcare costs and also helping to manage the symptoms that come when you're battling a chronic condition.
Yeah, I think that was definitely a fair question. And Cynthia, talk about a little bit more for those who may not understand the term evidence-based research. I mean, what exactly does that mean? And we'll get ready to set up for our next question. I believe we're going to hear from Juan in just a moment.
Sure.
But talk about evidence-based research.
Evidence-based, it just means it's been proven. These programs have come around and they've gone through what we're talking about here, extensive research to make sure that these programs are delivering what they say they're going to deliver. So for instance, if it's a fall prevention class, that we're going to see some differences in falls. We're going to see less falls, more activity. It just means that they have been proven to work.
Yep.
Yeah. And when you talk about falls, for those who may not understand, Community Council of Greater Dallas, you guys serve, again, a population of the elderly, things of that nature. So that's extremely important because, again, it's not just knowing that someone fell, but it's important to understand how they fell and what could be an impact as a result of the fall.
Yes.
Talk a little bit more about that and how you guys found that to be important to include in your programs.
So some of the statistics, it says that 1 in 4 adults 65 and over fall each year. So that's too many. But not only that, falls are the biggest the reason that people come into the ER for traumatic brain injury for 65 and older. From a fall, you might think a car accident, but actually it's from a fall. So we knew that there was a need, and so the researchers got together to decide what could we do to help with that. And that's kind of how a matter of balance, our fall prevention program was birthed.
Wow. So that's just an example of one of the many programs that you guys offered that, again, you think it's not that big of a deal. You don't think that it occurs as often, and you certainly don't think about the severity of it once it does happen and how it really could impact and alter someone's life.
Yes.
So thank you so much for that work. All right, so now we're going to hear from an audience member. Juan Rodriguez is joining us today. So Juan, thank you so much for being here. Hey man, I like the sweater and sweatshirt there. Merry Christmas to you as well.
Merry Christmas.
All right, so what's your question for us, Juan?
My question this morning is, what types of programs do you offer?
Certainly, we offer a wide array of programs. We talked just a little bit about our matter of balance, but we also have a diabetes self-management program, chronic disease self-management program, and a chronic pain self-management program. These three were initially created out of Stanford University, and we teach those. We have, as I stated, the A Matter of Balance program, which is the fall prevention program for adults 60 and over. We have stress busting for caregivers in case you are taking care of someone. And we also have our diabetes prevention program, which is a much more detailed program, and we'll talk about that in just a little bit. All of these programs can be done in person at your location, and we bring them to you. And because of this situation that we talked about with the pandemic, they can also be done virtually.
Thank you.
Wow. Yeah, so again, when we talk about that cutting edge technology and allowing you to be able to offer virtual classes, things of that nature. So Jessica, let's talk to you real quick about the programs that she listed off. I mean, that comes under your care as a director of this area. Talk about why it's important that you guys stay aware of all the statistics and things that relates to, like she talked about, the matter of balance and things of that nature.
Yeah, we like to be prepared because we never know when there's going to be a need from the community, and we like to be responsive to those particular needs. So we try to learn as much as we can. We go to conferences. We participate in the virtual conferences now. We try to learn everything that seniors need to know in order to help them stay healthy and stay at home. When you are able to be taken care of in your home, it is much less expensive than entering a nursing home for older adults especially. So if we can try to counter that, we think that we are helping our society out overall.
Yeah.
But we need participants in these classes. We can't just have them without having people participate.
Yep.
We need participants, and I think Cynthia may talk about later on, we need leaders, we need teachers to teach these classes, and that's why that's one of our call to actions items that we're promoting here today.
You know what, that's extremely important. Because I think, so many times it's not just important for the person receiving the care to take the class. I was the caregiver for my mom, and many times she would go to appointments and things by herself. But you know what I realized later, it would have been best if I had went along with her so I can learn while she's learning. So, because I'm the one who has to take care of her.
Exactly.
But if she has all the knowledge and I don't have any, then I can't be a caretaker for her.
Exactly.
So
that's a good point.
Doing it virtual so the entire family can get involved. We do
Good
have
point.
another question from the audience. Cliff Craven has joined us today. So Cliff, thank you so much for being here.
Thank you for having me, Mayor.
Absolutely. Absolutely, Cliff. Fire away with your question.
Oh, my question is how can participating in evidence-based programs help or benefit me?
So
Like it.
that's a wonderful question, thank you. So as we've discussed earlier, these programs are evidence-based. They've been proven to work. Before I answer that question, I'd like to just give you a few statistics. 6 in 10 adults in the United States have a chronic condition, and 4 in 10 of those adults have 2 or more chronic conditions. 30 million people have diabetes in the United States, and 84.1 million people are pre-diabetic, meaning they're on the cusp of having diabetes. There is a 50% higher mortality rate if you have diabetes than if you do not have diabetes. Also, more people live with chronic pain than cancer, diabetes, and heart disease combined. 30 million people in the United States are living with some form of chronic pain. And if that's not bad enough, we also stated that 1 in 4 adults 65 and older fall each year. So, how can this help you? If you have fallen, or if you have a chronic condition, or if you know someone who has fallen or has a chronic condition, or you're a caregiver of someone, these programs can certainly benefit you. They can help you to manage the symptoms. They can help you to increase your activity levels. They can help decrease hospitalizations, and also give you tools that you can learn to help break that symptom cycle that usually comes about when you're dealing with a chronic condition.
Well, when you hear you quote off those statistics, man, I mean, it really helps to paint the picture that, we really do need to take charge of our health. So, Dr. Kitzman, back to you. When we're talking about taking charge of our health, and you hear the numbers, because you probably already knew that information, but what's your message to people?
Well, I think there's two messages, and I'd like to tie these things together, which is that, like, for example, the diabetes prevention program that's been tested for 20 years in many, many randomized studies. The only way we know that the diabetes prevention program works for African Americans is because African Americans participated in those research studies. Mm-hmm. So we're able to say the DPP works for whites, blacks, Hispanics, Asians, because we had representation from all groups. So if we don't participate, then we don't know that that treatment works for us and for our community. So I think that is a huge component of this. The second issue is that with the amount of chronic disease that we have, it can seem overwhelming. It can seem like there's no way to fix this problem, but small changes. Go into a class. Go to a weekly class for 12 weeks. You can learn some small things that can really change your life, the life of people in your family, because you learn how to maybe cook a little better, or you figure out how to get that physical activity in that you need every day in a way that you enjoy. Those things can have tremendous long-term impacts. You don't have to change your whole life. You can make very small changes that have a big impact on your health.
Yeah. When you kick that off, again, it takes us back to the All of Us Research Program. So again, if you've been listening to what we've been talking about here today and you want to get involved, again, take advantage of the information that's currently on your screen to get involved in the research program, because again, if there's anything that has resonated with you that's, kind of hit home and think, you know what, I really could play a role in that, then we'd love to be able to hear from you. So take advantage of the information currently on your screen. As we continue to interact with our audience, we do have another question from the audience today. Sandra Contreras is with us today, and she has a question for us. Sandra, thank you so much for being here.
Oh, thank you for having me.
Absolutely, Sandra, and fire away with your question.
Where are these classes taught?
That's a great question.
Yeah.
These classes are taught all over the Metroplex. We are able to, as we stated, they're also virtual, so that is the first option, virtual. But they're all over the Metroplex, and we bring them to you. Some of the places that we go are churches, libraries, rec centers, senior centers, apartment complex meeting rooms, really wherever we can gather 12 participants together to take these classes. Also, we bring all of the materials to you, and these classes are absolutely free. If I can, I would like to just talk a little bit more about our diabetes prevention program. Dr. Kitzman did mention that, and when I talked about the classes that we offer, our diabetes prevention program is a little bit different because it's much more detailed. And I'd like to talk to our Monique Smith, who is the Special Projects Program Manager, and she manages that program, and she's here in the audience today to give us just a little bit more information about that particular class and also about our programs in general.
Absolutely.
Monique?
Okay. Thank you, Cynthia, and thank you, Heather, for talking about a little bit more about the DPP program. This are, like they said, all of our programs are evidence-based, which means that they have all been proven scientifically to work only if individuals and participants, they work the program. If they work it, it will work. This particular program, the Diabetes Prevention Program, is a year-long program. That's a long time. But when participants enter into that program, they're entering with the expectation that they will lose 5 to 7% of their body weight if they exercise physical activities 150 minutes per week. Now, we're looking at about 2 to 3 pounds a week if they go through this program and if they follow this regimen. Now, the last phase of this program is what we call core maintenance. Because if they have gone through this program and done everything that they are supposed to do by managing their weight and all those things in the core, they are able to be equipped, empowered, and they will be able to be given tools that they will be able to maintain at the level that they desire. And that's how our program works. So we encourage everybody to take part of that, because the diabetes program is not just a program to prevent you from getting diabetes, but it's a program that it's a life-changing. It's a behavior modification. So if you work the program the way it should be, scientifically has been proven that it will definitely work.
Wow. Thank you, Monique, for sharing that. I think that's extremely important. Now, one of the things that she pointed out was it's a year-long program. But you know what? We have to look at what's the trade-off. It's a year-long program, but if you don't do the program, you end up getting diabetes, then it's probably it's a lifelong disease.
Yeah.
So how do we, we have to look at the trade-off. Sometimes we have to make a little bit of an investment in ourselves to make sure that we don't have the long-term effect. We may think about the time that we have to commit to the research program. Well, think about the time you're going to have to commit to going to doctor's appointments if you end up contracting the disease. So I think it's important that we put priorities where they should be. So I'll ask you, how can people sign up for the classes?
Delighted to have you as a part of our life-changing team. Trainings will kick off early next year, so if you're interested, please do contact us. And once again, that's Cheryl Equinife. That number is 214-954-4247.
All right, good deal. Well, again, I know the Community Council of Greater Dallas, you guys are doing the training, but, Dr. Kitzman, that research, those leaders are important for you because it helps to further get more information out in the community.
Absolutely. We rely on community health workers, community leaders, volunteers, paid peer leaders, the whole range, because they're our voice in the trenches, in the field. And people learn best and can overcome mistrust when they're hearing it from people that look like them, act like them, they're from their communities, they feel like peers, and they can ask the questions that they may not want to ask me or someone else that they see, in a medical role.
Yeah.
Yeah.
So it's important. If you would consider being a leader, again, that's an awesome opportunity. Maybe you've always wanted to be involved in the community and participate in some way. Here's another way that you can do it. Go to Community Council of Greater Dallas, get the training and education that you need so you can do it in a informed way, and maybe even utilize some of your own personal experience that you may have had medically, but now it gives you an opportunity to present that and help others in a professional way. So it's something to consider. Talking about personal experiences, Cynthia, I want to now come to you. Talk about how you have utilized your personal experience to relate in the work that you do.
The reason that I got started in this field in the first place, my master's was in counseling. I had nothing to do with this, but my daughter was diagnosed with diabetes as a very young child, and I didn't know where to turn. I didn't know what to do, and I did not know how to take care of someone with diabetes. They told me she would need to have shots for the rest of her life. They gave me all these statistics, and I felt like I was doomed. But I also knew I needed information, and I was seeking information and found out about a diabetes self-management class. I didn't even know what does that mean. So I continued to dig, got the information, was very persistent, so persistent that they then asked me to join the team. And that's kind of how I've been in this field ever since. So it really started at home with a child who was diagnosed with this disease, and they told me this was going to last forever and it could cut her life short. So Mom just jumped to the rescue and said, well, what can I do?
Wow. Certainly commend you for that. Jessica, I want to come to you as we get ready to land this plane. You guys, when we talk about the All of Us research program, folks getting involved with research that's going to outlive any of us. It's life-changing work. What does it mean for you to be a part of this and to know that you're doing something that's going to impact, like we said earlier, future generations?
I'm just going to think about the concept that all of us use. Nothing about us without us. Think about that. Nothing about us without us.
Yeah.
If we're not willing to participate in something that's going to impact our health, what does it mean? What is it all about? So I think that's very important, and that's why when we think about this call to action, we want to encourage people to really, really take it serious. Consider research. Consider research. I'm a participant. I enrolled in it because I know that I want to help my future generations of grandkids. I want them to grow up to be healthy individuals. I want their kids to be healthy. And unless we start somewhere, and I'm starting, then, what else is there to do? Nothing about us without us.
Yeah, I love that. Well, Dr. Kitzman, I want to come to you. I almost want to just drop the mic and take up an offering there. She said it so well, and it's so true. But you, talk about the work that you're doing, the lives you're changing, and what does it mean for you to personally be a part of this, to know that, again, it's going to impact future generations?
I don't think I can even express into words how much research and including people underrepresented in research means to me, because it's easy to do research and help the people who are standing at your door. But those are not the people who need it, right? And so my mission has always been, I want to bring things to people who need it the most. black, brown, white, doesn't matter, the folks who need it the most. And when you talk about diabetes and chronic disease, it's hitting our black and brown communities the hardest, and they need the most help. So we got to make sure we're doing that outreach and doing everything we can do to get them into these programs, both the evidence-based programs and the research, so that we can develop new evidence-based programs and new innovations that work for everybody.
Exactly.
I love it. I love it.
Wonderful.
Cynthia, in closing, again.
I just thank you for giving me this opportunity to share what I do. I'm passionate about what I do. I kind of gave you a little bit of background of why. And these are wonderful programs, and I get the opportunity when I train and when I teach these to see that lives do change. People come into the class maybe a little skeptical. What can you teach me? I've been dealing with this disease for 20, 30 years, and they come out saying, boy, I didn't know that. So these are really life-changing programs. The research is life-changing, life-extending. So I'm just grateful to be a part of a wonderful team.
Yeah, well, thank you to each one of you for being here. And again, thank you so much for watching. And again, you just said something that I thought was great. It's life-changing and life-extending. But you can be a part of all of that by, again, taking advantage of the information that's on your screen. But again, it really takes us getting involved in order for us to get the help that we need. A great partnership that we have here with Chris Howell Communications and the Community Council of Greater Dallas. And we were proud to be able to bring you this type of programming, and we want to do more. And just before we close this one, anything more you would like to say?
I'd just like to leave you with, to enroll in the program, the All of Us program, www.joinallofus.org, Together Dallas. And I believe it's going to be on the screen.
It will be on the screen as well.
I thank you, Chris, for allowing us to be a part of this.
Absolutely.
Thank you.
Thank you. Now take charge of your health and get involved. Talk to you next time.